Okay, so now let's hang what they call a piggyback or a secondary line into your primary line, because this is your primary line, this is your main line to the patient. But the doctor has ordered antibiotics 3 times a day, so along with this. So now we're going to do our secondary. So you need your secondary kit, and it will say right on there, secondary. You can also, the telltale sign is when you pick them up, is there's always going to be like a little hangy thing in there with them, that blue hangy piece. So I've got that. I have got my secondary, and we're going to use this little bitty one. And it says 0.9 normal saline, which is, or sodium chloride, which is normal saline. But this is what you would use if, this is about the size of a piggyback. Most piggybacks are under 200 mLs. So I've just found this one, so we're going to use it. So the secondary tubing is similar to this, but it's short because it's going to attach to that first port that's under your drip chamber. Because we want it to go, ideally this would be the part that would be in your machine. And again, this machine does not fit this tubing. But we want the machine to control how fast our piggyback goes, so we're going to hook it in up top. Now, if you're going to add a piggyback into something, you need to be sure if you're adding anything into a primary line, do the 2 mix. Do the 2 substances mix. Normal saline goes with about anything. Normal saline can mix with 99.9% of the medications. But if you're not sure, always double check or ask your pharmacist. And I'm going to open. I said I'm going to open it. I'm going to open my tubing. And I'm going to get my tubing out. First thing you do when you open your tubing is close the roller clamp. So again, this has got a roller clamp on it, so you're going to close it. If I spiked my bag with that roller clamp undone, it's going to pour every bit of that medicine out. Now, these little antibiotics may not look like much, but if this is what your patient is getting 4 times a day, then you want to be sure they get every drop of this, and you don't want to waste any into the garbage can, or you don't want to not infuse it properly, because these little bags, like for example, antibiotics it may cost $20 for this. There are some antibiotics for this small of a bag could be like $900. So you want to take very good steward of your patient's money and be sure that they get it, and their health, to be sure they get it properly. Now, so we're going to hang this, and we're going to connect it into here. But the machine is smart, but gravity plays a part in this. So this comes with it. This is for your primary line, to hang it down, because the machine or gravity is going to pull whatever is the highest first. So take this down, and I believe some people hang it like this. Like, to me, you can do it that way, but I'm a worrywart, and I'm afraid that that's going to fall. So I hang mine up like that. So now we've got it lower, because when we hang our other one up here, see, it's going to be higher. And we'll set our pump to pull it, and it will pull what's higher first. So if you do it opposite, that's wrong. Your secondary bag has to be higher than your primary when it's on a pump, or even if you're not using a pump, it has to be higher. So I have got my piggyback tubing. Now you can do this one of 2 ways. You can hang it down here and spike and prime it. Now this is only a challenge if you're really short. You can hang it up here and spike and prime it. I'm going to do it down here. I've got my tubing clamped. Because what if I didn't have it clamped and this was a $1,000 bag of medicine and it just ran all out on the floor? You don't want to do that. Again, it's got a little injection port, and it's got the blue port. We're going to use the blue port. Throw that away. Take my top off of my spike. Then I'm going to hit that dead on. And you kind of screw it down in there. Now, I've got it clamped. Now I can hang it up like this, and I can let that roller clamp go, and I can let that drip into the garbage, but I'm always afraid that I'm gonna run too much out. Because if you get to talking and you could run that, look how little that is. You could run that out so quickly. So I usually don't do that. And you can be sure it's dripping, be sure you've broke the seal and it's in there. What you also can do is called backwashing it to be sure you don't drip any out. But again, you can unhook it and you can prime it and then clamp it back and do what I'm fixing to do. But this is what I like to do. I'm going to take my alcohol pad. Now before I can connect tubing to tubing, I have to scrub this hub for 15 seconds. So I'm going to scrub for 15 seconds. And these are all needleless systems. So like the syringe I had earlier, that will screw onto this as well if I needed to inject the medicine in, or this other tubing is going to. So I'm going to throw that off. And I'm going to screw that on without touching it. I need to screw it on like that. Now look, I still have got air in this part of my tubing. Remember, I didn't flush it. So what I can do is called backwashing it. If I let go of this clamp and hold it low, it's going to take that normal saline and it's going to flush it up into this tubing and it's going to get my air out. See it bubble? Here it comes. And there's all the air is out of my secondary tubing. So now all my tubing has got the air out of it. Then I'm going to hang it high. Now the new pumps now, once you get this going on your patient, it will cue you. Are your clamps open on your secondary tubing? So I would undo my clamp on this. And anytime I undo a clamp when I'm using a pump, look at me. I always make my hand move that clamp because sometimes you'll think you've got it in a clamp and it doesn't. So anytime I unroll that clamp, I always make myself move that tube because I want to be sure that when I program my pump that it is going to pull. Because I could have my pump programmed right, and if I have still got this clamped, it's just going to pull from here. It will not pull from up here. So you got to be sure that your clamps are undone. So read your pumps carefully and be sure that you are doing what it says. So now our secondary is set and ready to infuse into our patient. Now, we can't really tell by this. Let's see. See, this is a really old pump. But whenever you're setting your primary line, you would hit primary and you would hit the rate, and that's how fast you want it to go. There's usually a button that says VTBI. Let me write that up here. VTBI and LTC. VTBI means volume to be infused. So what is your volume to be infused? That's this big bag right here. If I hit primary, my volume to be infused is 1,000 mLs. At the end of the shift, they may have to do what's left to count. LTC means left to count. So at the end of my shift, let's say I have 500 left in my bag. So that's what LTC means. Now on my volume to be infused, if I was programming my secondary line and I'll hit the button that says VTBI, let's look at my bag. I've got 100 mLs in this bag. So my volume to be infused is 100 mLs in my secondary line when I go to program it. And then you hit your rate as to how fast you want it to go. And then your VTBI, or your volume to be infused. Not the milligrams, the volume, how many mLs are in each of these. Now we've got this all set up and we're just ready. I'm gonna clamp this back off. Now we just have to get our IV started for our patient.